Liver disease in our dogs. It's more common than you think. In this video, I'm going to be showing you the top causes and signs of liver disease in our dogs, plus the top 7 natural remedies that you can use to help your dog at home. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. One of the largest and most important organs in your dog's body is the liver. It's located here, just underneath your dog's rib cage. It tucks up next to the diaphragm, encircling the stomach. It's critically important for digestion, detoxification, the storage of sugar or glycogen. It breaks down red blood cells, it produces hormones, and it's really important for blood clotting. One of the really important things about the liver is that it can repair itself after injury or disease. So in many cases, if we can provide the right conditions, your liver, it can actually regrow that damaged area. The signs of a dog with liver disease, they are many and varied. Initially, it just may be a dog with a decreased appetite. They may be lethargic, depressed, and they may be classified as ADR, or in veterinary terms, we would call it, ain't doing right. As the disease progresses, there may be GI signs, vomiting and/or vomiting and diarrhea. Many dogs, they can show the classic sign of PUPD. That means increased drinking, increased urination. As liver disease advances, you may see low protein. The protein is called albumin. When that's low enough in the blood, you can see an increased buildup of fluid. It's known as ascites. Typically, you see that in our dogs as a swollen belly. In some cases with that low protein, that low albumin, you might even see that the tissue appears swollen on their limbs, for instance. A classic sign of our dogs with liver disease is jaundice. And what that means is you're seeing yellowing, typically on that white area, the sclera, as you can see above Tula's eye, that would be yellow. You lift up your dog's lips, look at their gums. Instead of being this pink color, they're going to look yellowish. In some cases, you can see the jaundice yellowing in the inside of their ear. Less commonly, you can see neurologic disease, circling, head pressing, ataxia or wobbling, and even seizures. There's one less common secondary skin disease called hepatocutaneous syndrome happening with their dogs that have primary liver disease. You can see these thickened, crusted foot pads, and you can see red inflammation in between their toes. Typically, your veterinarian is going to start it with blood tests, looking for 2 specific liver enzymes. One's called ALT, alanine aminotransferase. The second one's called ALP, alkaline phosphatase. But just because your dog has elevated liver enzymes does not mean your dog has primary liver disease. You also need to rule out pancreatitis, intestinal disease, diabetes, Cushing's disease. Certain medications such as the corticosteroids, i.e. prednisone, the anti-seizure medication phenobarbital, that can cause increases in liver enzymes. And the one liver enzyme, ALP, it's also produced from other areas. So some ALP comes from the bone. It's typically to see elevated ALP in a young, fast-growing dog. These are puppies, their bones are active and growing. That's producing the ALP. They wouldn't have primary liver disease. The ALP, it also comes from the intestinal tract. So a dog with serious GI inflammation, i.e. diarrhea from inflammatory bowel disease, they could have elevated ALP. So my point is you need to ensure that your veterinarian is looking at all the blood work, all the clinical signs, as well as the age of the dog before someone definitively says, yes, your dog has liver disease, let's look at these treatments. They can then do specific liver function tests to test whether or not really is a liver involved, such as bile acids. In some cases, a confirmatory diagnosis that would require an ultrasound and or a liver biopsy. Which what's causing this, you may be wondering, why does my dog have liver disease in the first place? In some cases, it could be a medication reaction. The NSAIDs, non-steroidal anti-inflammatory drugs, they can cause acute liver disease. Our dogs can get into garbage, in particular compost, often improperly fermented compost that's contained some type of mold. That can actually damage the liver, causing acute liver inflammation. And that was something I typically saw in practice. We'd have dogs coming in with neurologic signs. They are staggering, they're ataxic. They've clearly gotten into something. Blood tests, they reveal elevated liver enzymes, increase ALT, increase ALP phos. There is a toxin in mold, an aflatoxin that can specifically damage the liver, and most likely that was happening with these dogs. Treatment primarily involves supportive care, IV fluids, maybe an emetic if they'd recently consumed that toxin. 99% of these guys, they recovered in about 3 days. Your dog can get a viral infection causing hepatitis. Some of the dogs had liver disease as a result of lepto. Young dogs can get a type of liver disease called a PSS or portosystemic shunt. And what that means is the venous blood that comes from the intestinal tract is not going to the liver. There's an actual shunt. What this means is then there's a buildup in toxins. These young puppies, they're getting clinically really sick. And many of them are actually, when they come into the clinic, they'd be showing neurologic signs. One of the specific neurologic signs that they would do is called stargazing, where her head is tilted straight up like this. Some dogs, they can develop a copper storage disease. They're storing too much copper in their liver. These include the Bedington Terrier, the Keeshond, Dalmatian, Westies. If your dog has been diagnosed with liver disease, these are 7 supplements I think you should consider. Number 1, the most studied herb for liver disease in dogs. This is milk thistle. The active ingredient in milk thistle, it's silmarin. It is anti-inflammatory. It is an antioxidant. It's even an antifibrotic. In part, it's working by reducing oxidative stress in the liver. It is supporting and enhancing liver cell regeneration. Then not only that, it can protect the liver against toxin-induced liver damage. Milk thistle also enhances the detoxification process. So if your dog has been poisoned by AKA compost, it'll actually speed up removal of that toxin. It's got a ton of research. I used it in so many dogs. Really strongly encourage you to use it if you've got a dog with liver disease. We're looking at doses of the milk thistle of 100 milligrams per 10 pounds of body weight, once or twice daily. Number 2, this is S-adenosylmethionine, also known as SAMe. This is a nutrient. It's found in virtually every living cell in your body and your dog's body. It's a key antioxidant. It regulates a whole number of different metabolic pathways. But what research has shown is when animals have liver disease, they have marked low levels of SAMe. A number of studies have shown clear benefits of supplementing with SAMe with our dogs that have liver disease. It's hepatoprotective, being an antioxidant, and then secondarily, it can actually speed up liver cell regeneration. And this supplement I often use in veterinary practice as well. A typical SAMe dose, 100 milligrams per 10 pounds of body weight daily. And it works really well in conjunction with this guy, with milk thistle. And it really doesn't matter what type of liver disease your dog has. They really can benefit from milk thistle and from the SAMe. Number 3, the bioactive ingredient found in turmeric. This is 95% curcumin. Curcumin's a great antioxidant and a really important natural anti-inflammatory. So when liver cells are being damaged by free radicals, i.e. your dog has consumed some type of toxin, then the 95% curcumin, it's being especially beneficial. And so many underlying causes of liver disease relate to inflammation, right? Your dog has consumed the Medicam and it's damaged liver, all this inflammatory response. If you can decrease the inflammation, you can dramatically help the liver. And that's what this 95% curcumin is doing. The 95% curcumin has been extensively studied, and there's a number of different studies just showing how beneficial it can be for liver disease. Doses of our 95% curcumin supplement, 250 milligrams per 50 pounds of body weight daily. You just want to ensure that you're giving it with food, and in particular fat, so then it can be much better absorbed. If you have a dog with liver disease, they're not yet responding to the milk thistle and the SAMe, consider adding in the 95% curcumin. Number 4, coming from the yellow weed in your garden, this is dandelion root. In herbal medicine, this has been used traditionally to help support the liver. Studies have shown it to be hepatoprotective and actually aid in speeding up liver cell regeneration. The best way to give it would be giving it as a decoction, where you're taking 1 tablespoon of the dried dandelion root, you're putting it in a pot with 1 cup of water. You then simmer that for 15 or 20 minutes. Then strain out the dandelion root. A typical dog dose of that concentrated dandelion root tea will be 1/8 of a cup per 10 pounds of body weight once daily. Number 5, from the root of the burdock plant. This is burdock root. It's a dried root, very similarly looking to dandelion root. Also studied and shown to be hepatoprotective, especially when the livers have been exposed to toxins. Burdock's a super common weed grown throughout North America. In fact, I have some outside right now, it just it's under the snow, so I can't show you. Here's some of the dried root. Just like a brown dried looking root. It would be prepared and given much the same way you'd be giving dandelion root. You'd be adding in 1 tablespoon of the dried burdock root with 1 cup of water. You'd be simmering that to 15 to 20 minutes. You're going to let it cool. Be looking at a standard dog dose of 1/8 of a cup per 10 pounds of body weight daily. The last 2 ingredients, these include vitamins which have been shown to have clear benefit for liver disease in our dogs. Number 6, a wonderful antioxidant vitamin. This, vitamin E. Vitamin E, it's a fat-soluble vitamin that really concentrates in the liver. There have been a bunch of studies with vitamin E and liver disease, i.e. these dogs have copper storage disease, and what they're seeing is vitamin E is especially helpful in those situations. So being such a potent antioxidant, which is concentrating in the liver, the vitamin E is helping stop the liver from being repeatedly and further damaged. In my opinion, most dogs that have liver disease, they can also benefit from supplemental vitamin E. It's quite safe, especially when it's given an appropriate dose, and that would be 50 IUs per 10 pounds of body weight daily. This is the vitamin E liquid. It comes as a drop. Each dropper, or one single drop, that is 10 IUs. Tula is 20 pounds. That means you would need 100 IUs, which would be 10 drops of this liquid vitamin E. Do you want some? As an aside, vitamin E is great for topical skin disease. There's a skin condition our dogs can get. It's a little parasite called dermatococcus. One of the key treatments is this guy, topical vitamin E. Number 7. This is vitamin B12. When many dogs have liver disease, they have especially low levels of vitamin B12. And what some practitioners have found is when they supplement with vitamin B12, they're actually speeding liver cell healing. In some cases of specific dog liver diseases, dogs that are supplemented with vitamin B12, they show marked improvement in liver function. It's a very safe water-soluble vitamin, so if you give too much to your dog, he's just going to urinate it all out, especially when it's given orally. An easy way to do it is to get the 1000 microgram tablets, that's 1 milligram, pretty typical dog dose. A quarter of one of these tablets are 250 micrograms per 20 pounds of body weight daily. They are teeny little tablets. If you can see this little guy here, it's meant just to go under your tongue. You just want to, I would quarter that and give that to Tula. Or take one for me, also supposed to help mood, as well as my liver. If you've got a dog with liver disease, you've tried milk thistle, you've tried SAMI, maybe the 95% curcumin, nothing is yet to work, because there are some of those antioxidant and supplemental vitamins as well. So first, ensure your dog does have liver disease. Ensure your veterinarian has done the correct tests. And yes, you know you actually should be treating the liver, not an underlying condition such as pancreatitis or a dog who's on phenobarbital. Then, if that's the case, consider some of these alternative supplements. Thanks so much for watching this edition of Veterinary Secrets of my top 7 natural remedies for liver disease in our dogs. Click up there to subscribe, hit the bell icon for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.